Some good news tonight in Montana's fight against COVID-19. State health experts say vaccines could reach Montana by mid-December. This as we head into the Thanksgiving holiday and the state's COVID-related death toll surpasses 650. The first wave of Montanans could be getting a COVID-19 vaccine before Christmas. That announcement as the state's new COVID vaccination plan team meets for the very first time. Q2's Casey Conlon joins us with full details.
After months of trials and speculation, it appears that a COVID-19 vaccine is just around the corner for Montana. Officials at the Department of Health and Human Services said today they expect the first shipments of the Pfizer vaccine to be in the state around December 11th. The amount that Montana will receive is still unclear, but those doses will go to critical healthcare personnel and those at highest risk for life-threatening infection. The plan calls for a three-phase rollout. Phase 1, a limited supply, is expected to last 2 months from when the first vaccinations are administered. This will take a while since DPHHS estimates between 45 and 60,000 healthcare workers in Montana. Phase 2 will begin when an adequate supply of vaccine is available, likely in months 3 through 6. When there is a sufficient vaccine supply, Phase 3 will kick in.
Phase 3 is a phase that we expect to be at probably maybe this spring sometime when there is enough sufficient supply of COVID-19 vaccine that really anybody who wants to get vaccinated can.
There will be a 5-tier population focus, so no matter what phase we're in, this is how the vaccine will be distributed. After risk, those in rural communities with less access will be prioritized, with generally healthy adults rounding out Tier 5. There haven't been any COVID vaccine trials with children yet, so the vaccine will not be recommended to anyone under the age of 18. While expected to begin soon, the total process will likely take months because COVID-19 vaccines require 2 doses.
That second dose is super important to create that protection that we need, so it's going to be something that we're really emphasizing.
Both doses will likely be available to everyone for free. The vaccine is being provided by the federal government, and if there are costs related to administration at local levels, mechanisms are being worked out for no out-of-pocket costs, even to those who are under or uninsured. The biggest early challenges with Pfizer's vaccine surround storage and handling. Pfizer's product must be kept in ultra-cold storage between -70 and -80 degrees Celsius. While Montana does not currently have any vaccines requiring this method, the state is actually well set up for it.
Right now in the state of Montana, we have at least 6 or 7 known ultra-cold storage sites, very nicely spread geographically around the state. And then we know that there's a few more that will be coming on in the next couple of weeks. And what I heard from the CDC the other day was that was actually very good. There are some states or territories that have 1 or 2 in their entire state.
Pfizer is also requiring a minimum of 975 doses per shipment. And while they come in thermal containers that can hold ultra-cold temps for up to 10 days, it would still require a lot of vaccinations in a short time. Moderna's vaccine, meanwhile, is expected to be released a couple of weeks after Pfizer's, is suitable for normal freezers, and only requires 100 doses minimum, so it will likely be more suitable for rural areas. Wehner also noted that all of Montana's tribal jurisdictions were given the option to receive vaccine through state or federal agencies, and all except for the Confederated Salish and Kootenai tribes and the Helena Indian Alliance chose the federal route, so they will not be considered in DPHHS allocations. The coordination team stressed that they will continue to amend the plan as needed. Casey Conlon for MTN News.
All right, thanks so much, Casey.